We did have one other question as well. It says, I have arthritis in my knees, and I find that when I start to exercise routines again and again, the pain and inflammation gets worse, and I need to rest for an extended period of time before I can start again. What do you recommend for starting and being able to maintain a consistent exercise routine? They feel fairly comfortable with walking, but would like to do more for exercise than just walking. They're concerned because they're only 32 with our arthritis, and from their understanding, it doesn't get really better over time.
Right. Yeah. So, I mean, that is a young age to kind of start with developing some arthritis. Again, so like making sure getting that frequency down first, that's important. It sounds like you're a motivated individual to exercise. A lot of times with arthritic types of pain and inflammation, we talk about less impact activities. So walking is minimal impact. Things like running tend to be higher impact, and that's going to contribute to more arthritis, especially in the knees. The knees are a weight-bearing joint, and so any of that kind of repetitive impact really does kind of cause further wear and tear. So things that are non-impact activities. Biking tends to be a little bit easier. I find that a lot of people with arthritis do very well with aquatic exercise. You're in a kind of a lower weight environment, so you're not putting as much weight, especially on the knees, again, a weight-bearing joint, and still able to build strength and build flexibility and motion that way. So I think aquatic exercise is very good. And then relying on some of the additional things, I'm certainly not a med pusher or someone for injections. And at 32, I wouldn't recommend starting, steroid injections all the time. That would not be super beneficial. But looking at some of those things, the icing after activity, using a little anti-inflammatory, whether that's a topical anti-inflammatory or an oral anti-inflammatory, and kind of just looking at all of those different parameters. How can I exercise without really irritating the knee over too much? But for OA, the keys are lower impact activities. And so like aquatic stuff, biking is certainly better than running or a treadmill. Just building up good strength over that impact is important. So but it's tough. But when you start to develop some of these arthritic changes, especially earlier on, it can be a challenge.